A lot of you have reached out to us with questions regarding the coronavirus, and we are working hard to get those answered for you. Jennifer Pignate with our sister station, KNWA, spoke with a doctor at the Community Clinic of Northwest Arkansas to clear up your COVID concerns.
As more cases of COVID-19 are being reported in the state and here in Northwest Arkansas, we want to keep you as informed as possible. We're focused on the facts and not spreading fear. We asked you to share your questions and concerns about COVID-19 on our social media. And right now, Dr. Gary Berner with the Community Clinic of Northwest Arkansas will answer some of those for us. Dr. Berner, thank you so much for taking the time once again to speak with us.
Absolutely. We're here to help and hopefully can give out some helpful information.
Yeah, I'm sure you will. The first question, we have a confirmed case of COVID-19 here in Northwest Arkansas. Now, if parents are still taking their kids to daycare, what is something that they can do to, per se, disinfect them once they get home?
Yeah, number one, I'd encourage families to reach out to the daycare. Hopefully the daycares are already being proactive in informing the families. But understand what the daycare is doing to limit the risk and the spread. Are they putting limitations on who can come in to visit the daycare? Number of visitors that come in, the number of students, and if the students have any symptoms, does that limit them from attending the daycare? Are there other ways that they're taking precautions to clean their services, to make sure that their staff is symptom-free? So reach out to the daycare and to see what they're doing to help protect the children that are attending. Secondly, I think as soon as the families receive their child, go to pick up the child from daycare, important to have some hand sanitizer and go ahead and wash their hands. Then when the children get home, it may be overkill, but let's go ahead and limit risk and change their clothes. Potentially do an earlier bath time, an earlier shower time, or do a really, really good hand washing as soon as the children get home and go ahead and change their clothes.
So overall, just good hygiene.
Great hygiene, and then understand, too, what the school is doing to help protect their kids.
Okay, very good. Next question. Oklahoma is canceling school for the rest of the semester. Should Arkansas do the same thing? Is this an effective way to stop the spread of COVID-19?
That big of a public health decision, I would have to mostly defer to the Arkansas Department of Health and Governor Hutchinson. They seem to have been very proactive in giving us recommendations and understanding the risk of continuing school. So for the most part, I would defer to them. I do think the school closure that we currently have in place was important to be proactive as early as possible to limit this risk amongst the school. Fortunately, children have not been particularly high risk during this pandemic, but certainly can be a place where the virus is spread and then brought home to the families. So I know that the Department of Health is making all those considerations in terms of the need of the length of continuing our school.
And we've heard of vaccines and medicine being in the works for this. Is it possible to completely stop the spread of the coronavirus?
It is possible to spread. It is possible to spread. It's going to be really, really difficult. As we know, the previous version of the coronavirus that has caused the common cold has stuck around for decades. Flu has been causing illnesses and deaths for decades. So viruses are really difficult to stop. However, other viruses, by the development of medications and vaccines, we certainly have limited. So theoretically, it's difficult. Theoretically, we could stop it or very much limit it. It's this pandemic state that we're in, but it will be really difficult.
Now, a lot of people have expressed concern about getting the virus through surfaces. How long does the virus live on a surface? We've heard 2 days to a week. What's your answer to that?
In terms of how long the virus lives on certain surfaces, I think you're right on. I think I've heard maybe a little bit shorter times, potentially a couple hours on certain surfaces and up to multiple days on others. So I think your thought of 2 days to a week is very reasonable, and that's why we're really thinking about hygiene, cleaning surfaces. If you're symptomatic, quarantining yourself to a certain area so that you're not spreading that around your home, grocery stores, or other sites.
All right, so Lysol wipes and hand sanitizer always on you.
Yes, ma'am. Yes, ma'am. And plug in there, too, not touching your face to limit any runny nose, any respiratory secretions from being spread to your friends and family members and coworkers.
And here's an interesting question, too, that a lot of people are asking. Does your blood type matter in getting COVID-19?
I've seen that report. I've seen that report that came out of a study from China. And so that certainly is of concern. There is not enough evidence to really say that strongly yet. There's not been enough patients to be studied and to track that long enough for me to really confirm that concern. However, I just would encourage that all people are taking high precaution. All people are taking concern, regardless of your blood type. Certainly, we know if you have certain underlying conditions like heart disease and lung disease, kidney disease and diabetes, and other chronic medical conditions, that it is imperative that you recognize symptoms early on and reach out to your healthcare provider early on as soon as you get fever, cough, or respiratory symptoms to make sure that this can get started treatment on it as quickly as possible. So I'd focus a little less on blood type. That's a little bit of an unknown right now, but certainly focus on underlying conditions and things that would maybe hurt or limit your immune system. And then just all folks take precaution. Really pay attention to if you could develop a fever or if you have shortness of breath or cough.
Yeah, great reminder there. Even in this pandemic, life still happens. So some people are asking, if I need a home repair or an emergency and someone needs to come to my home, what do I need to do before they come inside? And then what do I do once they're gone?
Yes, we had to have our dishwasher repaired just on Friday, so I understand that concern. We were really impressed with the dishwasher service that we called. They had actually taken steps to protect their dishwasher service repairmen. And so in doing so, that gave us confidence that they were not coming in with symptoms because they were being held to their own standards. So I would certainly reach out to the company, reach out to the service repairman, or if they're coming to the home before you allow them to come in your home is very appropriate. Maybe not something we would have done 3 months ago, may feel a little unfriendly, but very appropriate to ask them, hey, we just wanted to help protect our family. Have you had any illness or recent symptoms? Have you had any fever? Are you feeling short of breath? Have you had any cough? And if they think that they have, I think very appropriate to delay that repair for that time period.
All right, good advice there. Those are all the questions. Is there anything that you would like to share with us?
I think we've seen improvement in people kind of heeding to the recommendations of the Arkansas Department of Health and starting to limit who comes into work and who's getting around. That being said, I think a lot of folks can still start to work on that, limiting their social interactions with other individuals. One way that we can begin to really limit the spread of this virus is if you are to get it, that it ends with you. Most people that are not elderly or don't having underlying conditions, that illness can end with them. They can stop the spread of it. And that virus cannot go from them to a family member, to a grandmother, to a coworker, and we can stop the spread of the illness that way. So if we really heed these instructions, we can make a big impact in the health of Northwest Arkansas.
Yeah, we all need to do our part and can't be too careful.
Yes, ma'am. Yes, ma'am.
All right, Dr. Gary Berner with the Community Clinic of Northwest Arkansas, thank you once again for sharing your knowledge with us.